Good afternoon. My name is Dean Foreman. I'm the Chief Operating Officer here at Chapters Health System, just outside of Tampa, Florida. It's a pleasure to be with you all today as we share our thoughts and ideas on innovation and how to advance the not-for-profit missions across the country. I'm going to spend a little bit of time today talking to you about our journey, our path that led us to this innovation, some history and context on Chapters, our geography, and our motivation behind this type of innovation. A little bit about some of the industry drivers that are impacting us and our thought processes, and then a good amount of time on the innovation itself, giving you some insights onto our path to supporting the communities, patients, families, payers that depend on us to do so. So let's get started. As you can see, Chapters is a family of many organizations. We have several hospice organizations: Good Shepherd, Hospice of Okeechobee, HPH Hospice, LifePath Hospice. We have a palliative care organization. Chapters Health Home Connect is our home health, home care platform. We have a durable medical equipment organization called All Care. We have our own pharmacy. We have a managed services organization. We have Chapters Health Care New, which is our population health division. And then, of course, our pride and joy, our foundation. Let's start with the why. So our mission statement, very simply, is to provide support and care for people in our community with or affected by advanced illness by offering a wide variety of compassionate healthcare choices. Everybody knows this story. In your community or ours, it's very common. It starts with an emergency hospital admission resulting in a hospice referral. Difficult discussions regarding the patient's prognosis. Patient passes quickly but peacefully at home under hospice care. And those famous words that we all hear, "We wish we had heard about hospice sooner." These basic events that occur in our communities every day has driven us to think differently about our approach to supporting the communities that we serve. What if we could pivot to or move to an early diagnosis of the chronic disease, an earlier introduction to Chapters Health System and the family of companies that can compromise transitional and care continuation through their advanced disease? What if we could develop customized care through case management, home health, and palliative care much further upstream? End-of-life discussions would therefore almost by definitions begin earlier with a natural transition to hospice. Our philosophy is if the patient and family knows Chapters and we know them much further upstream, a trust and a foundation is built. And our first encounter with them is not in the hospital, in the ER, after they've just heard difficult news. They've known us and we've known them. And those conversations will be easier at the appropriate times. And then finally, positive outcomes for patients, families, staffs, and payers, and the community that depends on us to deliver a better healthcare deliverable. No matter how you look at it or analyze it, volume of need is expanding. Supply and demand is very real. So are the headwinds. Population growth in the sectors that we serve is climbing aggressively. All while the hospice industry experiences changes and faces challenges like no other period in our history. Whether it's new payment models, population-focused care, consolidation, market economics, or increased regulation. All these are real and undeniable threats that impact our ability to sustain community-based, not-for-profit, end-of-life chronic illness models in our communities. Our thought process is we needed to pivot to innovation in order to meet the patients' and families' needs much further upstream and navigate these headwinds and challenges much more aggressively. Whether you believe in payment reform, competitive landscape, evolution, or simply regulatory pressure, no one can deny that change is imminent. Massive payment model changes are happening and pivoting right underneath of our feet. The market economics, supply and demand, increased competition, CON threats, if you will, in this state and many others that have the CON regulations. Caregiver shortages, wage pressures, and massive reimbursement changes are likely on our horizon. Population-based healthcare is critical. The evolution to population health management is in our hands and something that we could carry the torch nationally to have positive impacts. And increased regulatory pressure, no matter what it looks like today or what it looks like tomorrow, it's something that we can expect. And it's important that we have houses built on rock and stone when it comes to the regulatory pressures and threats in the environment today. This is all achievable. The state of the industry is massive change, rapid consolidation. Many organizations that are known competitors and others that are not known competitors are aggressively looking at the US healthcare market and figuring out how they position themselves to impact much higher outcomes at much lower costs. The good news is we're in the driver's seat to do this. And what I look forward to is a day where there's many moving circles in this area to support communities and the patients and families that depend on us to do so, that involve the not-for-profit mission in our individual states and communities. Let's talk a little bit about the what. So for us, we try and position patients, families, and community at the top of our organizational chart. Below that, you'll see Chapters Healthcare Connect, which I'll talk to you about in more detail in a few minutes. Chapters Health Home Connect sits on top of home health, palliative, hospice, pharmacy, and DME. It's basically a coordination of those services that Chapters is fortunate enough to directly own. Underlying to that is the entire forces at work regarding population health. And how do we manage our assets and resources to obtain better outcomes at lower costs and support coordination of care, transitional care with the communities that depend on us to do so. A large part of that, as we all know, is the social determinants of health, such as adult daycare, Meals on Wheels, transportation, support groups that are disease state specific, financial assistance, aging in place, and many other factors. It's hard to create a visual that conveys the message that all those efforts underneath Chapters Healthcare Connect in our minds and our thought processes need to be coordinated to deliver high value, high quality care with a lower cost foundation to the payers, whoever they may be. We believe the size matters in this case, and we are on a relatively aggressive geographical expansion over the state of Florida, where once we only served 9 to 11 counties, we've expanded east into Okeechobee, Martin, and St. Lucie, south into Miami-Dade and Monroe counties, and most recently into the 3A area in the state of Florida that takes us north of Citrus County there all the way to the Georgia border, up through the Gainesville area and Alachua County. So there's a massive amount of covered lives that are in that area. And we believe a coordinated care model where we can demonstrate that we get paid not for how much we do, not necessarily traditional Medicare fee for service, but how well we do it. And we think that will appeal to not only traditional Medicare, but many payer resources like insurance companies, ACOs, and the likes. One of the things we realize is, as a not-for-profit organization, as I'm sure all of you do, it's really important to make sure that you have accounted for your community impact and your community benefit. It's an important message to the communities that we serve. Not only the care that we provide, but the impact that we have in the community. It's a strong message to consider in each of your individual areas. So economic impact in the local economy for us is significant. Estimated total impact of jobs is also significant. And estimated total impact on local household incomes is upwards of $200 million. So take account for all your community impact and your community benefit. It's part of the story. It's part of what we're trying to do organizationally and as a not-for-profit community. It's a great message for payers and the communities that we're here locally to serve that depend on us. And after all, no matter where you're at in healthcare, it's always local. Some facts and figures on chapters, just for informational purposes. Almost 20,000 patients received care in 2019. Almost 24,000 grief service contacts, 2.5 million in charity care, 171,000 prescriptions filled. And probably one of the things we're most proud of is over 300 children received real-time live grief camps in many of the counties that we serve. We pride ourselves on excellence and the ability to display it through third-party validation. When we say we are better, we want to be able to improve it, as each of you do as well. Generally, we serve two purposes here at Chapters: either be caring for patients or those that do. We take great pride in our clinical outcomes and employee experience, and hope that you all as partners experience the same level of service and benefits. So let's talk a little bit about Chapters Health CareConnect. These are some really innovative slides and talking points, and there's a short video clip in here, and I'll be happy to take your questions at the end of this session in more detail. This represents the how. So we talked about the why, we talked about the what, now we want to talk about the how. And this represents a traditional non-acute, right, post-acute, pre-acute healthcare organization like Chapters, pivoting to a population health system and approach to care. Over the years, Chapters Health System has been part of many life stories in our communities. During that time, we have been the leader of community-based care, increasingly authoring earlier moments in the continuum of care, including pharmacy, medical equipment, home care, palliative medicine, and hospice. Now we are at a time in which all of our stories are being written together to face massive demographic and economic forces, new payment models, population-based care, and regulatory pressures. We believe to minimize costs but achieve the best outcomes will require innovative new models. In many ways, the US health system today and our advance to chronic care management is riddled with higher costs and poor outcomes. The complexity of our environment will change this. Alternative payment models, Medicare changes to the hospice benefit, and many of the things discussed earlier in this presentation will be driven to impact the flip side of the situation that we're in now, and that is lower cost and higher outcomes. I believe for not-for-profit hospice organization like ours and yours, to pave the way and carve the path, we need to think differently about our approach and to innovate in areas that will substantially drive higher outcomes at lower costs. To lead the way, on August 1st, we launched a single seamless care coordination support network, Chapters Health CareConnect. We named it CareConnect because it truly guides every patient step by step through their healthcare journey. As an organization, we felt that leveraging the strengths of our organization and collaboration with the community would be a key step in driving our culture to a new place, supporting the healthcare system as it is designed today. In real time, this network assesses and refers patients and their families to the right care in the right place at the right time for the best possible outcomes that we can achieve. We all have our healthcare story, whether it's yours or mine, a loved one, friend, or family. We've seen these healthcare stories around us. We're part of them every day. Our team members, our employees, and the communities that depend on us. We think there's a better way.
We all have a healthcare story. It can be confusing, and when that story includes serious, advanced, or chronic illness, the needs go far beyond traditional healthcare. Introducing Chapters Health CareConnect, a transformative new care coordination experience for patients, families, and care providers, offering higher quality care for less. One number, the first call to get answers, and the only number patients and families will ever need. Seamlessly connecting the exact need to the right care at the right time. An inspired innovation in healthcare to unify patients, families, healthcare, and social services. From Meals on Wheels, patient support groups, and transportation between appointments, to care providers, telehealth, and electronic records. Easier and continuously improving care, lowering costs, and optimizing outcomes. Helping patients understand what's ahead, who can help, where to turn, and what to do every step of the way. Chapters Health CareConnect, a connected partner transforming our healthcare journey together.
For Chapters Health existing patients, this support network integrates the best practices of centralized intake and referral management models, care models, payer and triage models, and even best-in-class patient support. In order to maintain existing relationships and build new ones, we have leveraged custom functionality with our phone system provider to connect the caller to the last agent the caller spoke to, assuming, of course, that agent is available. Our focus here is customer service defined in a new way. An organization that will wrap its arms around a patient and family in a different way in their journey through advanced, serious, and chronic illness. Your organization and our organization have done this for decades, and we're experts in the country at doing this at the end of life. For decades, we've been talking about moving this model of care upstream. This is the day, this is the time. Offering a single access point, patients and families are triaged by trained Chapters Health RNs 24/7, 365. In real time, our CareConnect specialists coordinate the right care and resources to meet patients' needs, providing a warm handshake between patients and providers. Beyond traditional healthcare, CareConnect also coordinates social services and activities such as Meals on Wheels, senior transportation, support groups as mentioned, and more through developing and evolving community partnerships. Behind the scenes, we are using state-of-the-art technology powered by predictive analytics and artificial intelligence to inform case management so patients seamlessly get to the right care at the right time in the right place. Clinical analytics, which help forecast patients, will be ready to move to another line of care offered by Chapters Health. The culture change that we're working on here at Chapters is really designed by several key lines and phrases that we continue to use. But never before has it been more appropriate for our organization to talk about the right level of care, the right time at the right place. Historically, we would answer the phone, "Thank you for calling LifePath Hospice," or "Thank you for calling Achieve Home Health," or HPH Home Health, or "Thank you for calling Chapters Palliative Care." That's a very defining way to answer the phone, and in our minds puts a patient or family or referral source in an immediate bucket. To pivot to a different approach where we're answering the phone, "Thank you for calling Chapters Health CareConnect. I'm your care specialist. How may I help you today?" That puts that RN in the consultative mode. So whether that patient is end stage, skilled care at home, personal care at home, palliative consult, or some other need in the community, we're now in a position to understand where that patient's at, ask some questions, and help guide that patient by a real-time live handoff to the right resource they need at that time. We believe that's a paradigm shift and important to the success of this model. To ensure best outcomes, we continuously track and improve our practices based on both qualitative feedback and core quantitative data like response time, time from referral to admission, call and referral volume ratios to staff, and customer satisfaction measures by patients, families, referral sources, and of course our internal staff. Our goal with Chapters Health CareConnect is to be the one call for the entire healthcare journey, to become the preferred care partner, providing care management for our community's entire patient populations. Together, making a difference. The paradigm shift here for an organization is to reach patients and families where they are. And in time, we believe organizationally we'll be known in the communities that we serve that when you're diagnosed with a chronic, advanced, or serious illness, Chapters Health System will come to mind. That is the resource that we want patients and families, doctors, payers, insurance companies, et cetera, to reach out to, understanding that once they connect that patient with CareConnect, we will have a team of people that will have that patient in their hands from diagnosis right through to hospice. It will take a lot of work, blood, sweat, and tears, and equity to change that culture and to change that paradigm shift. But we believe the time is right. We believe the environment is right. We believe the markets are right for organizations like ours and yours to step up with a different approach to holding the patients and families and communities that depend on us so much in a completely enhanced and different way. Chapters Health believes in providing our communities with the very best not-for-profit care. This is where our stories connect. Working together to provide the right care at the right time, in the right place, for the best possible outcomes for all of us. Thank you so much for your time today. It was a pleasure to be with you, and I look forward to answering some of your questions. Have a great afternoon.